What's up, guys? I'm Dr. Colin Miller, part of Pro+Kinetix. This is hip mobility. Hip mobility is very important. We use it for squatting, for deadlifting, to sit down, to stand up. We use our hips all the time, all day long. So why mobility is so important is because we have a lot of muscles involved that can really mess up our daily movement if they get tight. One of them being the psoas. The psoas is a muscle that starts at our femur, our big leg bone here, and actually works its way through the body and attaches up here at the back of the ribs into the spine. If it gets tight, it's going to hold us into what we call an anterior tilt, which can cause a lot of back pain, all right? If we're sitting in a prolonged time, that distance between my femur and my back shortens quite drastically. So now I'm in a much shorter stretch, and as I come to stand, I try to elongate that iliopsoas, but it doesn't want to elongate. So then what do? I anterior tilt, and that holds that, and we start walking like this, and this is how we get our back and hip pain. Another muscle that really starts to get tight in our hips is our piriformis. Our piriformis is a muscle underneath all our tissue of our glutes, and it's in the top corner of our butt here. That gets very tight very easily because it is a very small muscle, and it tries to overcompensate for weak hips. So if we have weak hips because we're sitting all day, then we get that tight piriformis, it gets inflamed, and for about 80% of us, that sciatic nerve passes by that piriformis, and that piriformis will grab that sciatic nerve, and you can start to get that pain down the leg. So if we need to get rid of that tight piriformis.